and I think you can begin.
Lovely. Well, thank you and hello everyone. I'm delighted to briefly discuss some of the themes that Professor Zard and I explored in our chapter in the newly published book, COVID-19 and Migration, Understanding the Pandemic and Human Mobility, which was edited by Ibrahim Sukeki and Jeffrey Cohen. Our chapter explores forced migration and health in the context of COVID-19. And next slide, please. So I want to start by introducing two migrant women. On the left is Angeline, an 8-month pregnant Honduran migrant who sought asylum in the US and was one of more than 200,000 migrants expelled without due process under a CDC order issued in March. This order uses COVID-19 as an excuse to shut down asylum at the US-Mexico border, though its public health rationale has been debunked by public health experts, including CDC officials. On the right is Lubab, an Iraqi refugee doctor who recently received a temporary medical license in New Jersey, allowing her to use her medical skills to help her community combat COVID-19. Angeline's and Lubab's stories reflect some of the global trends we've been seeing during this pandemic. And next slide, please. COVID-19 has profoundly changed our society and way of life and brought out the best and worst of human nature. On one hand, we are seeing a global trend towards nativist, restrictionist, and exclusionary approaches. Next slide, please. In the spring of this year, more than 190 countries imposed COVID-19 related travel restrictions, and 3 billion people lived in countries that had completely closed their borders to foreigners. Yet persecution and conflict do not pause for a pandemic. People fleeing their homes found themselves stranded by border closures, in desperate situations, and without access to protection. While some states exempted asylum seekers from border closures, honouring their international legal commitments, other countries have used COVID-19 to discriminate against asylum seekers or to advance restrictive immigration agendas under the guise of public health. In addition to the CDC order that I mentioned, Southeast Asian countries, including Malaysia, have used COVID-19 as an excuse to push back boats carrying more than 400 Rohingya refugees, causing dozens of deaths at sea. And these are just a few examples. At the same time, we are seeing a surge of racist and anti-immigrant rhetoric, stigma, and xenophobia around the world. Narratives blaming foreigners for the spread of disease are hardly new, but they have found fresh expression in a novel disease and infiltrated the highest levels of leadership. Finally, as countries begin to reopen their borders, we are seeing glimpses of post-COVID mobility systems with profound implications for access to asylum. For example, we've heard about corona corridors, health certificates such as the airline Common Pass, and the ugly spectre of immunity passports. Health screenings, testing requirements, and other hurdles are likely to burden or exclude refugees, asylum seekers, and other marginalised groups. Antonio Vitorino, the IOM director, warned that new mobility measures aimed at curbing COVID-19 may deepen inequality, declaring that health is the new wealth and the new game changer in town. And next slide, please. On the brighter side, the pandemic has focused attention on the vital contributions of refugees and migrants, including refugee health professionals and other essential workers. States including Italy, Germany, the UK, and the US have taken steps to ease the entry of refugee health workers into the workforce and to leverage their skills. There is growing recognition that we can only effectively fight this pandemic if we take care of everyone in our community. Early in the COVID-19 emergency, Portugal and other countries granted temporary citizenship rights to migrants and asylum seekers, providing access to national healthcare, social services, and financial systems. And next slide, please. For more than 70 million people displaced around the world, mobility is not a luxury, but a lifeline. As governments attempt to balance public health and mobility in the context of COVID-19, they must account for the rights and needs of people seeking protection. Overcoming this pandemic and rebuilding our nations and our lives requires a collective vision, a coordinated global response, and a commitment to leave no one behind. Thank you.